At Balanced Physical Therapy, our three pillars of excellence, as we like to refer to them, include manual therapy, therapeutic exercise, and patient education. Therapeutic exercise is essentially a very direct, very concise, very prescribed dosage, if you will, of a particular exercise or group of exercises aimed at accomplishing a very specific goal. After a thorough patient evaluation, including a review of a patient's medical history, any films that may be on file such as x-rays, CTs, MRIs, arthrograms, etc., a complete and thorough subjective history taking with the patient in the clinic, and a biomechanical examination of the patient's body, we will devise a carefully prescribed therapeutic exercise regimen to address that patient's impairments. The ultimate goal of the therapeutic exercise program, of course, depends on why the patient is seeing us for physical therapy in the first place. Are they somebody who just has a little bit of pain on the outside of their elbow because they've been hitting too many tennis balls? Or are they somebody who just had major reconstructive lower spine surgery? Those are two very different patients, and they both require a very specific dosage of particular sets of exercises, not to exceed certain dosages in the spinal reconstructive patient's case, because we certainly don't want to injure them after a major procedure like that. A lot of folks out there are seeing trainers and so-called experts and downloading information on the internet and trying this exercise or that exercise to address their own conditions that they think they understand. And while I commend those folks for doing everything they can to help themselves, what I would really appreciate is an opportunity to educate them, because most often a very small amount of exercise applied in just the right way can be much more effective at getting over things like pain, things like stiffness, and things like chronic discomfort than a whole bunch of exercises that we sort of refer to as a shotgun approach. When people throw everything but the kitchen sink at a particular condition, like maybe the pain on the inside of their knee, for example, oftentimes they end up exacerbating the problem rather than fixing it. And by the time they get to us, they're actually a lot worse off than they would have been if they had just come in a little sooner. So therapeutic exercise from a physical therapist perspective doesn't necessarily mean trying to turn somebody into the Incredible Hulk. No, it means perhaps for an 86-year-old female with osteoporosis being able to stand up without assistance from a chair. It might mean very specific, high-level, sport-specific conditioning for an elite athlete so that they can increase their vertical jump by 6 or 7 inches. It means all sorts of things, but it can only be applied and should only be applied after a very thorough subjective history taking, objective examination, and setting specific goals together with the patient. That's what we view therapeutic exercise as here at Balanced Physical Therapy and Human Performance Center.